Okay, what's going on? You feel like you can't breathe? Okay, anything else? Your heart feels a little bit racy. Okay. Well, I think I have something that will help you feel better. First, let me take your temperature if that's okay. Okay, good. I have the thermometer right here. I'm just gonna have you go under your tongue, okay? I'll just hold it right there. You're in good hands. I'll take good care of you and we'll get you feeling better in no time. How's that sound? Good. Okay, let's see here. It doesn't look like you have a temperature, so that's good. I will be right back. I think I know what will get the job done, okay? Okay, so I brought something that is called a breathing treatment. This has some medicine in there, and I'm going to put it in a mask that creates a vapor that you will breathe in. And what it's going to do is help you breathe. It's going to open your airways up and make the oxygen be able to flow in and out of there a lot better. And I think that's probably why you feel that your heart is a little bit racy, because if your airways aren't completely open and you're not getting that oxygen in there, then your heart is going to be beating a lot faster and be working harder, okay? So before I do that, I would like to just take a look at the back of your throat and make sure it's not red or anything. Just even though you don't have a temperature, you still might have some kind of bug going on, you know. So go ahead and give that a look, okay? Okay, good. So we will get one of these bad boys. I can just have you open and say "ah," please. Well, it looks okay. It doesn't look red at all, so I'm gonna go ahead and check your lungs, and we'll go from there. We'll just probably go ahead and right into the breathing treatment, okay? So I'll make this very quick. And I'll just have you take a nice deep breath, okay? Even if it's not a huge deep breath, whatever you feel like you can do, okay? Go in and out. Okay? Okay. Okay. Now I'm just going to reach around and listen from the back, okay? We're gonna do the same thing. In and out. Again. Good. Again, please. Good. Yes, you definitely have quite a bit of congestion in there. Mostly in your right upper lobe, but there is also some in the lower lobe as well. So what this breathing treatment is going to do, in addition to opening up your airways, it's also going to help loosen up any of that mucus that's in there. So more than likely you will be doing some coughing. Now, since this is the first time you're using one of these, correct me if I'm wrong, you've never used one before, is that right? Okay, good. Since it's the first time you've had one, what we're going to do is start off with just a few minutes and see how you tolerate it, okay? Now, if you feel that you're getting dizzy or lightheaded or that maybe you're feeling a little too nervous. Those things are very common, but if you feel it's making you too nervous or too jittery, or you're just not feeling well from it, then we're going to go ahead and stop, okay? Because I don't want you feeling worse. Okay, so I'm just going to pop this open. And we have some tissues here, okay? Because like I said, you'll probably be doing coughing. That's totally normal, okay? So don't be alarmed. Doesn't mean that you're going to be worse, okay? So we're just going to squeeze this in here. That's our medicine, okay? Now, I was gonna put it around your head as a strap, but how about I hold it there for you, okay? Since it's your first one, maybe it'll be a little easier and not make you feel so uncomfortable if we don't have it on. I'll hold it for you. How does that sound? Okay, good. Okay, now it's very loud, okay? The mist will probably be cool. It's very loud, okay? So I'm gonna push the button in 3, 2, 1, okay? Does it feel okay there? Take some nice, slow, deep breaths. Try to go in through your nose and then out through the mouth, okay? Doing great. Is that okay there? Yeah? Feel okay? Doing very good. Very good. Take a breather at all? Don't worry, that's okay. I just had a reaction to something. It's okay. We're over halfway done. you need a tissue, okay? Get another one out of the box. Like that means it's almost empty. So we're almost finished. Take these off. Now, let me give you a couple more tissues there for that cough. That's perfectly normal, okay? So don't be alarmed. In fact, it's a good thing to be coughing. It's a very good thing because you don't want any of that sitting in there. You don't want to end up with pneumonia. If it doesn't come out, then you could easily end up with pneumonia. So it's a very good thing if you're coughing. Let me give you these tissues. Now, how does your heart feel? Okay, well, it's not any worse. No? Okay, well, that's very good news then. Because, like I said, a lot of times your heart will be even faster from the medication that's in there, okay? So I'm glad that you tolerated it so well. We're going to go ahead then and get you a prescription for those, and you want to go ahead and do one in the morning and one in the evening, but you can do those as much as 4 times a day, okay? This is all you need. This is 1 dose, okay? And you don't want to save it either because you don't want germs and stuff getting in there into something that you're breathing, okay? So this is a one-time use thing. You'll load that up and then you want to give that a rinse out, okay? So yes, in the morning and in the evening, maybe not too close to bedtime in case it does make you a little racier, and up to 4 times a day, okay? Anytime that you're feeling that you're short of breath again, that you're not able to get all that air in there, you know, definitely do one. Try to wait 4 hours in between, you know, that's ideal. So we're gonna get you a prescription for that. And is there anything else that we can do for you today? Okay, well, I really think that you're going to do very well with this. And I think it's definitely going to be something beneficial. And you'll notice that when you start using these routinely, you're not going to be in a situation that often where you're at a point where you're so anxious because your heart is racing. You're not being able to breathe. So, okay. Okay, well, I'll be right back with your prescription, but it was nice to meet you, and I hope that they help and that you're feeling better soon.